Now we will hear from Anjali, Professor of Medicine at Mayo Clinic, on transforming automation in healthcare, expanding human capacity to care. As Medical Director of Mayo Clinic's Enterprise Automation Hub, Anjali has launched 100+ AI and automation initiatives across the Mayo system. Please welcome her to the podium.
Great. Thanks, Steve.
Yeah, come on.
Let me play the video.
You should just press that.
Thank you.
Just press the slides and the
Okay.
video.
Great. Thanks. Well, good afternoon, everyone. I guess a little different flavor for the next 20 minutes. As Steve mentioned, I'm Anjali Bhagra. I am a practicing internist at Mayo Clinic. In my prior life, I was a practicing radiologist, and I will declare myself as a technophile amongst you all, but clearly with no domain expertise that I've been hearing all about. Well, Bruce, thank you for the invitation. It's great to be back. I graduated from the CSAIL AI Mini Masters for Senior Executives last year, and it's just fascinating how the world is moving forward. So over the next 20 minutes, I know we've heard a lot about manufacturing. I'm going to take a little detour with a focus on operations within a service and a care industry, because a lot of organizations are candidly evolving and changing. And I think the differentiator of a good leader in this space is not just driving efficiency, but it's really creating the conditions necessary for human beings to thrive in an era where machines are becoming our best friends. And most importantly, for those of us who deeply care about system level change, how do we use these technologies, in my case specifically for healthcare, to create resilient systems with human in the center? So this conversation really matters to me a lot, and it's been a delight learning from all of you. So I want to begin with this slide. At Mayo Clinic, our guiding value is that the needs of our patient come first, and that's the lens we bring to everything that we do at Mayo Clinic, including automation, AI, clinical care, research, education. Everything is guided by this. And for us, most importantly, this is not about a technology integration. This really is about taking better care of our patients, bringing more access to our patients, driving the right outcomes for our patients, finding the diseases in a pre-cure stage where we don't have to cure them, but we prevent them overall. And then finally, also creating a value proposition for those of us who are at the front lines in a very challenging healthcare industry. So that's what guides us. Our goal is not more technology. Our goal is better care. I do want to emphasize there was a great discussion earlier in the panel about change management and how candidly 40% of the Gen AI leaders are committing 20% of their resource into change management. And I think it's critically important to understand culture and what drives human incentives. And if there's one thing that I've learned in my sort of deployment of this is focusing on the behavioral science. And I think that's key to adoption and investing in people as well as trust. So before I go further, I do want to acknowledge we get recognized for the care we provide. We are laser focused on our patients. The recognition is important, but it matters to us because it really signals our commitment to our patients. And before I go further, I want to share a short video that was created by BBC in their series highlighting meaningful automation across industry. As I said, this work is not about technology. It's about people, it's about purpose, and it's about future of care.
I was like, wait, what is this? Because it really hurt. I instantly was like, oh my gosh, I must have cancer. And then I found the tumor in my breast.
A lot of the patients we receive have serious and complex conditions, and time is of the essence. So we really needed a system that was intelligent enough to extract information from a variety of different documents. The generative AI performs that extraction, summarizes it into a cover sheet that an agent is then able to review for accuracy, and then that individual is able to move it forward to the next step in the process.
After my doctor put the referral into Mayo Clinic, he had told me that it might take up to 7 days. I got the very first call in just 2 hours.
Mayo Clinic invested in this technology because our patients needed it. So with this automation, patients are getting the help that they need sooner. For the patients, that means hope.
Definitely a relief to be able to say I'm cancer-free.
What I appreciate about that piece is that it reminds us automation is most meaningful when it expands the human capacity for care rather than distracting from it. Now, in spirit of sharing amidst scientists and evidence-based experts, I thought I'll include some numbers. I really appreciated the conversation where there was a contrarian view by one of the presenters earlier about the emphasis on scaled projects versus pilots. And while I'm a believer of that, I think it's a completely different scenario when you're dealing with people versus machines, and when you're using these algorithms and integrating them into clinical care, candidly, and the operations that fuel this. So I share this just to highlight that we've had roughly, and actually this number is growing by the day, so this is a ballpark, but close to 100 intelligent automations underway at Mayo Clinic. We have over 1,000 of our staff engaged within citizen development programs. So these are leaders that are inspiring our frontline teams to use intelligent automation through their day. And as you can see, there is a broad array of the kinds of things we are doing, ranging from robotic process automation to AI-driven document processing to AI-driven summarization, all the way up to physical AI and robotics. And we're going to have a discussion later to highlight that as well. So pretty staggering impact when we talk about operational capability within a complex organization like ours. We have over 84,000 employees, and we see more than 1.5 million patients every year with hundreds and thousands of surgeries performed at Mayo Clinic every year. So as I said, our goal is not technology for technology's sake. It really is to expand our care team's ability to diagnose diseases faster, take care of our patients with personalized treatment plans, with the latest and greatest individualized treatment, and make sure that our workforce spends most of their time on mission critical work versus burdened in administrative tasks. Many of you have probably already seen the statistic of greater than 30% of close to $5 trillion into cost of healthcare goes into administrative tasks. And that number is what we want to be able to solve for. This is to demonstrate that there is no single team doing this work at Mayo Clinic. It really is collective intelligence, and which means there are 3 big things coming together. First is our teams, whom we empower with the right skills, the tools, as well as challenging them with the questions that they need to answer day in, day out. Second is transforming our workflows. Because this is not about super niche, I can automate my task, but about entire workflow automation. And finally, without enabling collaboration between the different verticals within an organization, we don't create the ROI. So we want to ensure that we use automation to also enable collaboration between our different structural as well as infrastructural elements within the organization. None of this work is possible without a strong foundation. We heard a lot and we saw great examples all day long regarding the kinds of investments different sectors are making in this. For us, this is largely around 3 things, I would say. It's data, it's talent, and it's compute. And some of you may have heard about the Mayo Clinic platform, and that is essentially bringing high quality, de-identified, anonymized, heterogeneous data from across the globe and combining it with clinical expertise that we have curated over decades, and finally, trusted industry collaboration, and really providing that ecosystem for creation, validation, governance, as well as deployment of everything AI, ranging from digital all the way to physical AI. I would say the data piece in healthcare for the data experts in the room is probably one of the most rate limiting and challenging component to this all. As you can imagine, healthcare data is not only complex, it's fragmented, it's longitudinal. I have followed some patients over 20 years in my practice, and their data keeps evolving. It sits in islands, different planets. And so the task of interoperability of data and getting this all ready for tokenization and creating insights and leveraging signals to the clinicians is probably one of the most complex things within the practice of medicine. The Mayo Clinic platform has really impacted the progress on this, and we've touched close to 50 million lives across the globe with greater than 200 AI projects in partnership with industry across the spectrum. I heard a lot about Center of Excellence and how the critical ingredients of success, and I love the pillars, Bruce, that you do in your survey about executive leadership and everything that's needed from infrastructure to the ingredients required. And this is what that transformation healthcare ecosystem with Center of Excellence looks like at Mayo Clinic. It's not one team, it's many different teams working together, some that are focused directly on our patients, such as the Center for Digital Health. I spoke about Mayo Clinic platform, which is one of the largest growing repositories of de-identified healthcare data. The AI program, as well as the enterprise automation team, we work closely in determining what kind of foundation model building we're going to focus on, what kind of partners we would work with, and how do we leverage and bring these tools both within our institution, but then also scale them across healthcare. We truly believe that we have a distinctive role to play in this field. Healthcare is a tough industry to survive due to a very complex healthcare economics. But considering our commitment, we definitely are committed to taking care of one of the most complex patients, but then also coming up with ways to share that expertise outside of our walls. We carry the responsibilities that come with it. And the key ingredients to make this happen is, number one, trust, which is extremely important. Second, making sure that these innovations happen at care delivery and not in a design studio only to be integrated later. So we are very, very committed to these being integrated into our day-to-day workflow with a total focus on impact on our patients and accountability for outcomes. Like I said, our outcome is very care-led, directly integrated to patient care. And I want to share examples of how we are doing this collaboratively. We heard from Thomas earlier about the LGO program, and very glad to partner with MIT and working with the brilliant expertise here to deliver that. As I said, we don't do this for the sake of technology. Technology is half of the work, and the majority of the work that we leaders at Mayo Clinic are also focused on is moving our culture along. For organizations like ours, there is a strong legacy and heritage that we all are proud of. And it also is incumbent on us to move that in a direction that allows us to continue to create the impact that we've done over the decades. One of the I would say the base of this pyramid is establishing trust and transparency. Many people have highlighted the importance of this, and I think it's with a base of that, with appropriate skills and partnerships, that we begin to do the culture shift that we all need for this. This is also how we think about partnership. Mayo brings complex care delivery at scale, and we would not be able to deliver this without the excellent partnerships that we have across industry, starting from tech partners to academia, with startups in every stage of evolution. We are here to partner fiercely with anybody with whom we can co-create solutions for our patients. I think the key ingredients for us is to ensure that when we foster these partnerships for operational excellence, we highlight the importance of complexity of the environment that we work in with humans and not machines, making sure that we embed technology and then create accountable innovation. I want to walk you through some use cases so you can better wrap your head and arms around the kind of things we are doing internally. And I would break them into three big buckets. First is helping our patients and families navigate a very complex environment, helping minimize friction for them. Second, I would say, is reducing the administrative burden and friction from the supply side for our staff and workforce. And finally, accelerating resilience into our business. Considering that, talking of patient impact, how many of you have gone to your doctor's office only to notice that your physician might be so distracted typing on the computer and possibly asked you a question twice or thrice without even realizing that? I see a lot of head nods and a lot of hands up. And trust me, I've been there. And that's not the reason I decided to pursue the practice of medicine. I decided to do this because of the hope and healing I want to offer to my patients every single day. But it's the reality of the practice of medicine that detracts a lot of physicians from what they went in for. So an example of offering a solution for this, ambient listening technology, is something I use in my clinic every single day. For 15 years in my practice, I've researched burnout, resilience, and stress management. And I can tell you for the longest time, we admired the problem and were sitting in analysis paralysis. We came up with lists of why greater than 50% of healthcare is burnt out, but we couldn't find scalable solutions to address that. But today, we are at an inflection point, and we have that opportunity. So now I use an ambient listening tool in my clinic every single day, and my patients feel the difference. I give them my undivided attention because I know by the end of the visit, I will have a note ready for me to then take accountability and edit and remove the inaccuracies. So that's a real life example of how technology impacts patients. Another quick example, how many of you have had an EKG in the room? And how many, keep your hands raised if any one of you were given your cardiac age and the risk of developing heart failure based on your EKG. Okay, so I see 100, majority of the hands come down, right? But that's the kind of EKG you'll get at Mayo Clinic. So please, for your next EKG, come to Mayo Clinic. You'll get a full dashboard, an AI EKG dashboard of your cardiac age, of your risk of developing many other cardiac conditions. So that's the kind of patient impact I'm talking about. Wayfinding, patients find it extremely difficult to navigate the friction of a complex healthcare organization. A great example, digital concierge. We use a hologram for this, but there are other ways of doing this. I talked about documentation assistance. Transplants. I really want to highlight this. If any of you have had a loved one listed for a transplant, and let's take example of a kidney transplant, it takes on an average 350 days from listing to getting a decision on whether you will get that transplant or not. That's an entire year loss. That could mean a tremendous amount of quality of life in terms of patient impact. That's the kind of friction we want to eliminate. Research acceleration. We've seen a lot of examples today already about how this enables acceleration of research. This isn't about hypothesis testing, but research is getting embedded into clinical care, with insights being highlighted by these tools. And of course, staff impact. You can only imagine if someone like me, after 15 years of researching burnout, can, for the first time, feel like we have some solutions. There is real staff impact. And there's plenty of other examples, document intelligence. We heard this earlier about rev cycle management, but also for us, structured, unstructured documents that come to us for seeing patients, massive amount of delays across the globe, but that's something we can address. And you heard it from our patients, from days to 2 hours. That's the kind of efficiency we are building. And I'm going to save our discussion on physical AI for later. We have an entire panel on this. Many other efficiencies that are enabled. One plugin that I want to put is for transparency. With one of our intelligent documentation initiatives, we are projecting close to $60 million of saving just by documentation of the kind of work that happens. Here, I'm going to leave you with a peek of how this is happening at Mayo and creating excitement amongst our staff.
I think the energy today is palpable.
It's got a really great vibe, no pun intended.
I feel the energy in the room. Everyone's excited for AI and automation.
I think there's a huge opportunity here for pretty much every group, every department.
And it starts here, it doesn't end here.
What I hope staff really see this as a big event is a building block, a stepping stone for the future of where we're going.
This is an event where possibilities are becoming realities, and we are able to share that far and wide with colleagues across Mayo Clinic. Really, this work is happening by our people, for our people. And that was like a mic drop moment for me.
The exhibit hall is like buzzing with excitement and enthusiasm. I think the other thing is networking with people, really seeing that everybody wants to participate in this and everybody wants to be a part of it was exciting.
Mayo is at the forefront of both healthcare and technology. And so melding those two things together for not only our patients, but our employees as well to make our jobs easier.
It's a companion, it's a tool. And I think as long as we have that mentality and perspective, the sky will be the limit.
I hope people really feel the excitement and that this continues to catapult us and to continue to accelerate and leverage automation and these new tools and technologies that are now available to support us.
We're not stopping automation. This is the beginning of our effort to transform healthcare. And we're using automation to invest in our people and empower our people so that we can continue to drive transformation together.
This has been a year of great learning, and I'm so proud of the immense work, the effort, and the outcomes we are driving for our patients and our staff together. Great. Well, thank you for your attention. I know I'm out of time for questions, but I'll be around in case anyone has it. Thank you.